So my name is Amelia Brown, and in this video I'll be showing how to do heart rate, respiratory rate, blood pressure using palpation and the auscultation method, auscultation of the chest, and a Glasgow Coma Scale assessment. This video is shot on the 11th of May and the 13th of May, and throughout the video I have standard precautions of safety goggles. Is it alright if I just check your pulse?
Yes.
Yeah, so you just put your arm on the table like this. Be alright, support it. Can I just pull your shirt back a little bit?
Yes.
Feel your pulse. So I found Mrs. Jones' radial pulse. So I can feel that it's beating regularly, so I'm just going to count for 30 seconds. If it was beating irregularly, I would do it for the full minute. So pulse is normal, Mrs. Jones. It's alright.
Okay.
Now I just also wanted to check your breathing rate. So I just want to do this by counting the number of breaths you take in a minute. Is that alright?
Yeah.
Yeah. So you just continue to breathe normally.
Okay.
And I'll just time for 30 seconds. Because I can say that she's breathing normally, real regularly, I can just do it for 30 seconds and multiply that by 2. But once again, if she had irregular breathing, I'll do it for the full minute. So your breathing is also fine, Mrs. Jones, that's alright. So in this scene, the non-verbal communication techniques they used was getting at Mrs. Jones' level so she doesn't feel intimidated by me. Also used eye contact, so she feels like I'm talking to her rather than at her. Also proximity to her, so I'm not encroaching on her personal space. And I'm using an appropriate tone of voice when talking to her. I'm not being rude or demanding. So I was just wondering if I could take your blood pressure, Miss Jones.
Okay.
Have you ever had your blood pressure taken before?
Yes, I have.
Might be easier to just take your one arm out of your sleeve and put it on the table like that.
Okay.
So I'm just going to find your pulse again. I'm just going to find Miss Jones' radial pulse. And I'm going to pump up the blood pressure pump until I can't feel this radial pulse anymore. Then I just listen with the stethoscope.
Okay.
So I'm just going to place the stethoscope over Mrs. Jones' brachial artery to auscultate her BP. When I put it in there, I won't hear any sounds. Once I start pumping it up to about over the value I just got for the palpation method, I'll begin to hear the sounds, which is measured when the heart's in systole, or the contracting phase. Once I begin lowering, I'll begin to hear sounds caused by the turbulence and vibration of blood from the constricted artery. These are known as Karakoff sounds. So this point marks the systolic value. So that's, if I keep releasing this till I can't hear any sounds, that'll be the diastolic value. When the heart's in dystole, the relaxation phase, when the heart's refilling with blood. So I've got 110/70. It's alright, Jones. So the non-verbal communication techniques they used in this scene was, once again, I'm at patient level. I've used eye contact when talking to her. I'm in close proximity to her, so I can still do a skill, but I'm not going to encroach her personal space. And my tone of voice is friendly and talking loud enough so she can hear me. I want to have a listen to your breathing. I want to do this by listening to your back. So is that alright if I do that?
Yes, it's fine.
So I'm going to put the stethoscope on 8 parallel locations down in the stranger's back, starting from the apex to the base of the lungs. Listening for any unusual sounds, air entry, and that the left and right lung are equal. So I'm just going to start by doing that. If you're just leaning forward from Mrs. Joan, that would be good, thank you. Thanks. If you just give me a quick cough just to clear your lungs of any... So is it alright if I just put the stethoscope down your shirt? Is that okay?
Yeah, that's okay.
So you just take continuous deep breaths in and out. So I'm just going to listen for 2 breath cycles of each point. So Miss Jones, your breathing sounds fine. So it's all good. So in this scene, the non-communication techniques that I used was sitting at patient level, my body language, so when I stood up I didn't stand over in a threatening manner. I used silence so that she could focus on her breathing without distracting her. And I used appropriate touching so when I lifted her shirt up, it wasn't, you know. So Miss Jones, can I just ask you some questions? I just want to ask you some questions. They might seem a bit silly, but
Okay.
could you answer them?
Yes.
So you can just tell me what day of the week it is,
It's Monday,
the year,
2013,
the month,
May.
and do you know where you're at the moment?
I'm at home.
Because Miss Jones was able to answer all those questions correctly, showing that she's alert and orientated. So for verbal, she get a score of 5. Also because she was able to look at me while answering them and have spontaneous eye opening, she get a score of 4 for eyes. I just have one more request. Could you please just squeeze my hands?
Okay.
Thanks. Thanks, Miss Jones. Because she was able to obey that command, she'd get a score of 6 for the motor response. So she'd get a score of 15 in total for the Glasgow-Coma scale. And for the non-communication techniques that I used in this scene, I had appropriate gestures. So when I put my hands out, she knows to squeeze them. Had eye contact, the proximity, so I'm keeping a comfortable distance between Miss Jones and I, and silence, so she has time to